Welcome back, everybody. Exactly 9 months after the first person in Florida tested positive for COVID-19, the state has now passed the 1 million case mark. Since June, the state has added 100,000 cases monthly. And with Thanksgiving last week and other holidays like Christmas, Hanukkah, Kwanzaa coming up, some worry the number of cases will skyrocket. Joining us on the morning show is Dr. Pauline Rolle, head of the Duval County Health Department. Thank you for joining us today. You know, we are looking today at other states. Florida is one of 3 to hit 1 million COVID cases. Why are we in this situation?
Well, the virus is still out there, so it was inevitable at some point we would hit 1 million cases. This is a virus that continues to spread throughout our community, across the country and across the world, really. The vaccine is on its way. It's not here yet. But even after a vaccine, we will still continue to have cases. And so it was inevitable we'd reach this mark at some point. We just didn't know when.
We didn't know when. And we saw such a big spike in the summer. And I think that really pushed us up where we saw lower cases at the beginning of this pandemic. You know, I think we all know someone at this point who's had the virus. Some communities we know are hit harder than others. We also know people who've contracted the virus and have had more mild symptoms. Does that seem to be the trend that you're noticing?
So we're seeing both sides of the spectrum. We're certainly seeing quite a few people who have mild cases or no symptoms at all. We still see quite a few who don't have symptoms and they get a positive test. And it's hard for them to believe that they actually have the virus because they hadn't exhibited any symptoms. But we still have those who are getting admitted to the hospital, ending up on ventilators and dying. Fortunately, we don't have as many of those in our community as we see across the country, especially in some harder hit communities, but it is happening.
Yeah, and I think it's important to note, you know, that it is still happening so people don't get complacent and say, hey, if I get the virus, I'll probably be fine. Again, that is not always the case.
No, we're actually seeing people who are getting the virus for a second time. We don't necessarily have any identified cases here in Duval as of yet, but there have been cases reported across the U.S. Related to folks having had COVID and now having it a second time.
Right. So what about the vaccine? You know, we're all waiting for that to happen, hopefully sooner than later. When it does come to Florida, we know we're going to get some. Will the health department have any control or contribution to distribution?
So the Department of Health does have a statewide plan for distribution of vaccines. We are following the lead of the CDC and the federal government as it relates to those vaccines. And so as everyone has heard on media outlets, hospitals will be one of the first to get those vaccines. In particular, University of Florida, I know, has indicated they will be one of the first. And then we will roll it out from there. And so healthcare workers are first on tap. Of course, long-term care facilities are being talked about among that first phase of people. And the health department will be a part of the distribution of the vaccine, particularly to the community. But we're also helping with other groups in the community as well.
Yeah, because we know there are a lot of people in the community who don't have doctors. So the health department really is their source of that health care. So it's important that you're able to get it and distribute it. So now that we've looked at this since March, you know, we're here in December. What are we learning through contact tracing, especially when it comes to children?
Well, interestingly enough, what we're finding is quite a few people know who it was that gave them the virus because it's often a family member or a friend who they spend quite a bit of time with. And so with children, and in some cases, it's their friends or it's family members that they've been in contact with. And so surprisingly enough, in the beginning of this virus, it was often folks didn't know who they might have been in contact with. But we're finding more and more now who actually can identify a source. Again, because now with cooler weather, we're going to be spending more time indoors. But in some cases, we're coming together for the holidays. And so that is increasing the spread a bit as well.
And one message, Dr. Rolle, that has not changed, all the things that we all can do to prevent this virus.
Yes, certainly. Wear your mask, cover your nose, cover your mouth, and it needs to go under your chin, not here. We emphasize that over and over again. Hand washing is certainly important, and socially distancing. Even if you're outside, it's going to be important to include social distancing as a part of your planning when you're out and about, and certainly if you're having family gatherings. And so those things have not changed.
All right.
And
yes,
I might say, get your flu shot.
Yeah, we talked about that yesterday, the flu shot, so we don't have an inundation of people in the hospital for COVID and flu. Thank you so much for talking with us today. I love that advice, you know, wear the mask properly. Don't get complacent. Yes. So stay with us.